Thank you so much for giving me the opportunity to come and speak today about libraries and health literacy. The Oklahoma Department of Libraries got involved in health literacy about 6 years ago, so we're pretty new to this. Around that time, as Marisa mentioned, Dr. Andrew Pleasant came to Oklahoma to share basic information on health literacy to representatives of the library, literacy, and health communities. After that meeting, and along with some of the involvement that Marisa just talked about, and with some urging and assistance from Wisconsin Health Literacy, I decided to write a grant and receive the funds to launch health literacy initiatives in 5 pilot sites in Oklahoma. Just to give you some background, Oklahoma is ranked the 46th healthiest state in the country, according to America's Health Rankings by the United Health Foundation. Our 2014 State of the State of Health report card shows failing health grades in such things as our mortality rate, our prevalence of diabetes, our consumption of fresh fruit and vegetables. We received a score of F in physical activity and are the 6th most obese state in the nation. These are just a few of the health issues that Oklahomans face, and some of these things are things that libraries can help address as health literacy partners. So why libraries? Well, a 2015 Pew Research study indicated that 73% of people who visited a public library in America went there looking for answers about their health. Another study by the Institute of Museum and Library Services showed that over a 12-month period, an estimated 28 million people used the public library to seek assistance from a librarian or to use resources and computers in the library to find out about health and wellness issues, including learning about their medical condition and finding healthcare providers. So the question was, why libraries? And the answer is because people are already using their public library to find answers about and information about their health. Libraries, maybe this is because I work at a library, are trusted community institutions that offer a non-threatening environment to all members of the community. They are places of lifelong learning, and I hope that in the next few minutes you will see why libraries make excellent partners in health literacy efforts. So there are many reasons and many ways that public libraries may be able to assist in health literacy efforts. The computer and internet services available at public libraries can provide access to reliable health information for people who do not have access to computers or internet access elsewhere. In fact, 70% of rural public libraries are the only providers of free internet in their communities. Librarians are information experts, and they offer their assistance free of charge. Some public librarians are taking courses to become health information specialists. Libraries provide print and online access and resources, but many of our sites also have such things as blood pressure monitors, accurate scales, and pedometers for patron use. Libraries offer free programming for adults, for children, for teens, and these can easily include health literacy and health and wellness topics. And libraries can help promote health literacy efforts in their communities through their networks. Libraries may be able to offer space for health literacy programs, health programs, wellness programs. And finally, libraries may have access to state or federal funds that can be used for health literacy. Keep in mind that most librarians don't even know what health literacy means. They may be intimidated by the thought of initiating a health literacy project or even becoming a partner. So one of my roles in Oklahoma has been to provide ideas, technical assistance, and support to these libraries. Each of our grantees was asked to plan their project based on actual community needs. So they had to go to that some of those documents I showed earlier, the State of Health report, and look at their county and see what health issues were receiving scores of F in their community, and to work with their partners to design projects that would address some of those needs. So many focused their efforts on healthy eating, healthy exercise, using and accessing credible health information, and providing community education through programming. I'd like to share just a quick few of these. This project was in rural Healdton, Oklahoma, and it was a hands-on program for children on healthy eating. The children learned why it was important to eat fruits and vegetables and why they should control salt and sugar intake. This was all part of a summer pickle making class at the library, and it was presented by a family and consumer sciences educator. This photo shows one of the gardens built between the public library and the county health department. Children help plant and tend the crops, and the library offers programming and exercise classes for children and adults in the gardens. This is a virtual Route 66 walkathon held in Elk City, Oklahoma, where individuals and teams were challenged to walk the distance between Chicago and Santa Monica, California, and to record that virtual journey on a map in the library. 60 individuals walked a total of 16,261 miles, and articles about the project appeared in the local paper, which also contained information about the benefits of increased exercise. Here's an English as a second language class in Claremore, Oklahoma, where English language learners practice speaking and reading English by using health-related curriculum and real-world health materials. And this last class shows a free Tai Chi class that was held weekly at the Moore Public Library. You might have heard of the Moore Public Library, or Moore, Oklahoma, a couple of years ago. It was hit by a tornado and devastated much of the town. But this is post-tornado, and you can see that there's quite a few participants in this class. Library sites were required to partner with other organizations in their community. So along with health departments, this cross-sector of collaborations was one of the most rewarding and interesting parts of this project. So this was from the final reports of my project last year, showing more than 43 community organizations that partnered to promote health and wellness in the communities across Oklahoma. And just a few of them would be the Council on Aging, local doctors and dentists, food pantries, grocery stores, tribal health centers, senior centers, and the National Network of Libraries of Medicine. These partners provided instruction, in-kind services, resources, funding, awareness, and a wealth of ideas to help expand the projects locally. It's true, libraries make great health literacy partners. I want to mention that many public libraries also get state dollars from the state library, which is where I work. So if anybody's interested in how to get state libraries interested in making this a priority, you may call me at any time, 8 to 5, Monday through Friday. Since we got started 6 years ago with 5 sites, at the end of next week, I hope to award 25 to 30 health literacy grants in public libraries. It's been a wonderful outreach at all levels. It's very hard to sum up 6 years of projects in 10 minutes, so I'm going to end with a quick quote, 3 quick quotes. This is from a public librarian. Good health for the community has been a mission for me. I didn't realize how poor our health was until I began looking at the statistics. It is very important for libraries to address the needs of their communities, and it is a great need in Oklahoma. And here's an English as a second language student who offered this with the help of their tutor. I lost 34 pounds as a result of my literacy program. Even though I'm studying for citizenship and I'm working on English, I like the weekly weighing on the scales in the literacy office. My tutor helps me record my weight, and she helps me read information on walking and eating better. I'm smiling because I can see the results. And my last thing is a website that's an educational site for librarians called Web Junction. And Web Junction contains a section called Health Happens at Libraries. And this includes information, webinars, and all kinds of things on the library's involvement in health. So I hope you agree that libraries make great health literacy partners. Thank you.